I have been a dental professional for 21 years now, and I'm currently a mobile dental hygienist with my own practice where I clean patients' teeth in their own home, something that I really, really love to do. And patients love it too, believe it or not. They love me coming into their home. But I'm going to let you know products that I personally recommend to my patients and why. So, this is a great video if you're a patient or if you're a new dental hygienist, a new dental assistant, and you just kind of want to know what products are real dental professionals actually using and recommending. And I'm also going to let you know what's recommended sometimes that I wouldn't recommend. Maybe by the dental association, maybe studies have shown that this works better, this toothpaste works better over that toothpaste. But what I see in my patients, if it doesn't work, I'm not going to continue recommending it. Studies are one thing, but what I see in my actual patients is going to be another. So, number one is I really like Sensodyne toothpaste, okay? And I guess I shouldn't really name a company, but it's true. If I have a patient that says they're sensitive or they can't even drink cold water, they're about to get their teeth whitened, I will always recommend the original Sensodyne toothpaste, number one, or I'm going to recommend the newer Sensodyne toothpaste, which is called Sensodyne Rapid Release, or is it Rapid Relief? One of those. The main ingredient you want to look for is potassium nitrate. And make sure your Sensodyne doesn't include baking soda or does not include plus whitening, because that actually makes the toothpaste more coarse and it makes the potassium nitrate, which is supposed to prevent the sensitivity, not work as well. It's a marketing thing. You might be wondering, why are they even selling Sensodyne plus whitening if it doesn't work? It's a marketing thing and people buy it. Or if you don't want Sensodyne, use a toothpaste that says, Crest sensitive or Colgate sensitive. Just make sure it has potassium nitrate in it and keep it simple. Ask your dental professional if you're not too sure. Another toothpaste that I highly recommend, just kind of a generic, would be a toothpaste with sodium fluoride. Okay. Sodium fluoride. There's different types of fluoride. There's stannous fluoride, sodium fluoride. There's a ton of different ones. Now, research has shown that stannous fluoride is the best one to use because it's going to do so much for your teeth. It protects the teeth against cavities, it protects the teeth against sensitivity, it helps to remineralize the teeth as well, meaning it makes the enamel stronger. And if you have a tiny cavity that hasn't had a chance to go through the enamel completely yet, it can actually reverse the cavity, among other things. But what I find is stannous fluoride really stains the teeth. Now, do you want a mouthful of cavities or stained teeth? You probably don't want anything, right? So, what I tell my patients is stannous fluoride is recommended, but if you notice your teeth are staining more, I'm going to switch you back to a toothpaste with sodium fluoride because sodium fluoride doesn't stain. But studies have shown that stannous fluoride doesn't stain either. But I disagree. I can literally tell when my patients switch a toothpaste in 90% of the time by the amount of stain they have on their teeth. The first question I ask is, have you switched your toothpaste in the past 6 months? And they usually say yes. They bring the actual tube of toothpaste to me because I'm in their own home and it has stannous fluoride in it. Now, if they don't care about the stain, I don't care either. Maybe it just means I need to see them more often to clean their teeth to help them get the stain off because toothbrushing doesn't get stain off very well, in my opinion. You need the actual dental scalers to really help get in there, but you have to be careful. But if they don't mind the stain, then they can continue using that toothpaste, no problem. But typically, stain is the number one chief complaint of patients. They don't like stained teeth, right? So, I would recommend a different toothpaste with fluoride. Now, what about mouthwash? Mouthwash has been shown to work. It has been shown to eliminate the bacteria in the mouth. And for those people who can't use the water pick or who can't clean in the teeth, in between the teeth, with a string floss or anything like that, mouthwash is shown to be better than nothing. So when I see patients in nursing homes, especially, if they're able to swish with mouthwash, because sometimes they can't, if they're able to, I tell their caregiver, have them brush twice a day. They probably have to do it for them, or the staff has to do it for them, but also allow them to have mouthwash at least twice a day. That movement does actually help to clean in between the teeth. Not as good as using a floss pick or a water flosser, but if they can't use that because they're 99 years old and they can't really get in there, mouthwash might be okay, as long as they don't choke on the mouthwash, as long as they're able to spit. Okay, so that's very important. I tell parents of children at the very least, have your child brush 2 times a day and use a mouthwash. What mouthwash is best? It's kind of like toothpaste. I suggest any mouthwash with sodium fluoride. There aren't too many mouthwashes with stannous fluoride in there, but if you find one, that's okay. As long as it's not staining your teeth, you're fine. And you just have to swoosh for a good 10 seconds. If you do it for 2 seconds, okay, it's not going to do anything, but you don't have to do it for 2 minutes either, where it's burning your mouth. 10 seconds is completely fine. That's usually how long I can do it before I have to spit it out. Okay, so look for a mouthwash. What about manual toothbrushes or electric toothbrushes? I always recommend a soft toothbrush. That's the basic thing that I do say is just a soft toothbrush. They actually, studies have shown that medium toothbrushes work better to clean the teeth, but unfortunately, they cause damage to the gums. And over time, they cause damage to the teeth as well. So it cleans the teeth better, but it also causes damage. No, thank you. That's where a soft toothbrush comes in. If you're brushing for 2 minutes twice a day, that soft toothbrush is doing an amazing job. That's all you need. If you like electric toothbrushes and you want to use an electric toothbrush, go right ahead. That's perfectly fine. The thing about electric toothbrushes is, though, you don't want to push too hard because that can cause damage too. You just kind of want to let the toothbrush do the work because it's already spinning. Let it do the work and clean the teeth that way. Teenagers love electric toothbrushes because it's doing the hard work for them. That's completely fine. The true test is when your dental hygienist cleans your teeth and lets you know if there's a lot of plaque there or not. I've even had patients switch from a soft manual toothbrush to an electric toothbrush, and I've actually told them to switch back to a manual because they weren't cleaning their teeth as well with the electric toothbrush. Maybe they were just getting a little bit lazy, maybe they didn't know how to use it. I do take the time to show them how to use it, but if it still doesn't work 6 months later, they're getting more plaque than before, I just simply let them know and they usually go back to their manual toothbrush. Now, what about cleaning in between the teeth? Believe it or not, my number one thing to use is a water flosser. I don't recommend string floss. I don't recommend floss picks. I always recommend a water flosser because it's easier and patients actually use it. You can get an electric one, or sorry, you can get a cordless one, is what I meant to say, or just a normal one to plug into the wall. They're usually a little bit larger. Take a look on Amazon. They can be $30, you guys. They don't have to be expensive. I have a water flosser under the sink in every bathroom of my home. I highly recommend it. I use them multiple times a day. I love them. Once you start using a water flosser and you're not using it, like let's say you go away on vacation and you don't bring it, you can tell your mouth don't feel nearly as clean. I recommend a water flosser to everybody. Young, old, it doesn't matter. I'm going to recommend a water flosser to you. So, I would say these are the main products that I recommend. Let me know if you have any specific questions. If somebody tells me they like a charcoal toothpaste, there are certain products that I recommend over other ones. Use a charcoal toothpaste, not just charcoal powder, because that's too abrasive. But I'm going to recommend certain things to them that are not only going to help the teeth, but also protect them and maybe even whiten them in the process. You never know. So let me know if any questions. Thank you for watching, and I'll see you guys in the next one.